I am the show.
I am the show. I am enough entertainment for the patient. Am I not enough for you?
Oscar,
Sorry.
Dental Cribs, it's Dr. Tara, and as always, we brought some great practices to you, and I will tell you that Milton, Georgia has one that you're not going to want to miss. Smile Studios is here with Dr. Alexandra Coleman. Enjoy.
Hey, Dental Cribs, welcome to the Smile Studio. Come on in. So we are the Smile Studio of Milton in Milton, Georgia. Next week, we will be open for 1 year, and we are a general dental office, but also full facial aesthetic. We have 4 dental operatories and 1 aesthetics op.
So I saw this when we walked in.
You have to tell us the story behind it.
Yeah, I actually made this myself. My mom and I made it, and my sister on our kitchen island. So we made it literally piece by piece and tried all the different fonts, and it was so much fun. And I brought it in the day my contractor was like, okay, today's the day the flooring's going, and you need to bring it in. And I brought it on this thing, and everyone was like, okay, don't move a muscle. This first op, we do all of our aesthetics in here: botox, filler, skin, anything. It's all in here, and it's obviously a little more feminine. This is probably my favorite room. It's just bright.
Just what you need for cosmetic.
That's what you need. Yeah, just what you need when you're asking for needles to the face. Yeah. So this is my office. I spend a lot of time in here.
I would too.
Yeah, the windows, the view. So there's a dog spa next door, and so dogs constantly walking up and down this. So it's really fun to just sit in here and
Dopamine burn.
yeah, just look at the dogs, look at the puppies.
Very bright in here.
Yeah.
And again, you do a great job making everything so cohesive. Hey, pink wall. We got flamingo on the wall too here.
Yep.
And then you got to show us them. This
I know.
is one of the coolest features, and I will say, I've never seen this in a practice.
Really?
Before. Never.
Oh my gosh,
Never.
it's probably, well, I said the Botox room was my favorite, but this is probably my favorite part of my office. I put a bathroom in here. The best thing I did, got a shower, like full bathroom, and I have double of everything. Definitely the best decision I made. And when people are asking me oh, I'm thinking of doing a startup, I'm like, get your private bathroom. So we do, obviously because we do so much aesthetics, we do a lot of before and afters on this wall. This is our sterilization. It's just, basic, I feel like.
It is not basic.
Oh.
The last thing I would describe this room as, let me show it off for you. Look, the reality is there's going to be some sort of system, right?
Yeah.
But how you set up that system, the fact that you're able to put it in front of patients so that when they come by and they're seeing it, just so clean. Obviously, we're here visiting, so we don't know what it's like when it's hectic. But I imagine you do a wonderful job in keeping everything fresh.
This is our break room. I wanted to have a lot of space to just hang out. We're all friends and we like to just hang out back here. And so I wanted it to be kind of cozy, and tons of windows back here. A lot more people watching.
I have to say, I think it says a lot about you as a practice owner, a leader, and a doctor, that you chose, in my opinion, one of the nicest spaces to be for the staff.
Yeah.
Because it sets a precedent for them that you care about that is their well-being. And for me, if I came in here for a lunch break, I would really enjoy it.
My advice for a startup: find a team of people. Start with a contractor, and whoever your contractor recommends for this, go with them. And then whoever that person recommends, build a team of people that all work really well together. Because they all worked well together, it took a lot of the burden off of me in terms of having the accountants speak with the bank and having the contractor speak with the painters. And so that was probably the best thing I did, was just could have price shopped and I could have gone with less expensive people. But this team all knew each other really well and worked together really well. And so it took a ton of the burden off of me. Okay, so let's go into the operatories. So currently we have 3 functioning dental operatories. We have 1 that's waiting to be an operatory when we need it. So this is our hygiene room. And all of the operatories have windows, which was super, super important to me, because what else are you going to look at?
Yeah.
The ceiling.
I am the show.
I am the show. I am enough entertainment for the patient. So we don't have TVs on the ceiling, but the music's always really loud and super fun music. And so some people do ask for TVs, and I'm like, am I not enough for you?
Oscar,
sorry. So these are my 2 operatories, and this one's my main operatory because it has the nicest chair. Sit in it. I know, right?
Also, really like the color.
Yes, so this is a custom color,
Of course.
not to be extra.
Tell this. I have not been able to see the new
Oh,
ADEC.
okay. It move. You just like hold this and it moves. And it's nice because I'll show you. If you're working and you can like grab the handpiece and then you can kind of just like let it go. So yeah, we've got intraoral cameras attached to every delivery system.
I didn't realize that was a camera.
Yeah. So it just, as soon as you pull it, it pulls up on this screen right here. I hate having to be like, hey, let's take a picture of this really quick. And then they have to go grab a camera and plug it in. And I'm like, Well, one thing that I really do regret, and this is like actually a construction perspective, is not having as much privacy in the operatories. I wanted them to be open. I didn't want doors on them, but I wanted a little bit more privacy in between them. But I didn't know any of these construction guidelines. But ADA says that the opening has to be like a certain width or whatever. So we lost a lot of privacy, and that bothers me every day.
So CBCT, I noticed. Yeah. So not everyone has the Mac Daddy CBCTs. Correct. So what in a day-to-day use? What's CBCT?
To be honest, I use it mostly for diagnostics. That wasn't what I bought it for. I bought it because I was really heavy endo. And so all new patients get a cone beam. And then we do periodically, just the same way you would do any other series of radiographs. It's such a good educational tool because the patients can visualize things a little bit better. And they think it's really cool. When they see that 3D skull, they think that's very cool. So
I also remember that I forgot that you did endo training, like extensive endo training.
Extensive endo training, yes.
So are we still in love with endo?
So
are we still?
Ask me when the last time I did a root canal because I can't remember. Yeah, very much worth my time. Yeah.
Okay. Just fell out of love with it?
Yeah. So like in the program, I used a microscope. And then when I went into practice, before I owned a practice, I didn't have a microscope. And so I felt like I wasn't doing the quality of work that I was used to doing. And I also don't like to do things if I'm not perfect. And so I felt like I wasn't offering the quality that I could offer. And so I just kind of backed off. And so you never really picked it back up.
That's okay.
I always knew that this was what I wanted to do. I knew that I wanted to work for myself. We're learning every day and we're learning together. And, I do not have all the answers. And so I rely heavily on my team. I have a great staff and amazing patients.
Thanks for watching another episode of Dental Cribs. Like and subscribe if you want to see more content. And if you're interested in being on our show, let us know. And as always, thank you to our sponsors, ADEC and Patterson. You all make this possible.